Hello, good morning. Today we are going to discuss about urine cytology. So let's move. The urine cytology is useful in diagnosis diseases involve the mucosa of the urinary tract infection. So it is essential modality for the detection of urothelial neoplasm. So when we consider the urine cytology, the urine, it can be obtained by three methods. One is voided urine, catheterized urine, brushing or washing specimen. So urine for cytology assessment can be obtained by catheterization of the bladder, washing of the bladder with a saline or as the normally voided sample. So method of obtaining urine for cytology. So first one is the voided urine, voided sample. Actually, this is the commonly used method to obtain urine sample as it is readily obtained and non-invasive. However, cells in voided urine show degenerative cells in voided urine show degenerative changes such as increased nuclear and cytoplasmic density, and most of the time shows contaminant cells from the genital tract, especially in female. Uh, at least three samples of voided urine should be submitted for cytology in suspected cancer of the bladder. So, normally the volume of the voided sample is 30 to 35 of urine. So here we already discussed if you want to identify the cancer of the bladder, so we need to submit three samples for that. So when we consider the catheterization sample, so the cellularity of the catheterized sample is better than a voided sample. So the disadvantages of this method is that it is not a sample that urothelial lesions. So here only we can observe the cellularity, but the advantage is the cellularity is higher compared with the voided sample. But disadvantages, um, urothelial, if you want to observe the urothelial lesions, this is not suitable for that. Right. So next one is the bladder wash or the brushing. So the sample obtained by washing the bladder with saline is better than a voided sample as the samples are better preserved and more cellular. The major disadvantages is that this method is uncomfortable, expensive, and carries a risk of infection and cannot be performed as a routine procedure. So, the cells obtained by the above method should be cytocentrifuged, fixed in alcohol, and stained with the panicle stain immediately, and refrigerated and processed as soon as possible. If a delay is anticipated, immediate fixation with 50% ethanol may preserve the specimen for several days. Direct smear can also be made but are low in cell number. So when we consider the disadvantages of bladder washing and the brushing, this is uncomfortable to the patients, and this is the expensive process, and uh, uh, during this process urate, the bladder can get infection, and normally we cannot do this method for routine procedure. So when we consider the normal cells in urine specimen, first one is the transitional or urothelial cells. So these cells range from approximately 10 microgram to 100 microgram. These cells range from 10 micrometer to 100 micrometer or larger little. So it's look like a little larger than the lymphocytes, right cells. So when we compare the size, the urothelial cells are little larger than the lymphocytes, but the size is nearly 10 micrometer to 100 micrometer. And all transitional cells or urothelial cells may contain glycogen. So, other feature is when you consider urothelial cell, it contains glycogen, which may be washed out during processing, or the resulting in a clear appearance of the cytoplasm. So, what happened during the processing? This glycogen is washed out. So, at the final, when we staining and other things, when you observe on a microscope, the cytoplasm appear clear. Or without processing, when you are observing, you can see the glycogen inside the cytoplasm. So you can see the cells morphology here. Normal urothelial cell have uniform appearance with the abundant cytoplasm in the small nuclei. Normally, we know if the mature cells, when we consider mature cells, NC ratio, nuclear cytoplasm ratio is lower. Here also you can see abundant the larger volume of the cytoplasm, and the nucleus is very smaller. So when we consider the high grade bladder cancers, so bladder cancers are here, you can see larger nuclei, so the morphological changes we can observe very clearly. The NC ratio, nucleus and cytoplasmic ratio, is higher in high grade bladder cancers because these are immature cells, so the active cells, they can divide, they can involve in mitosis division. So the cytoplasm, when we consider the cytoplasm volume, it is smaller in cancer cases, and the nucleus is the larger one, right? So when we consider next the umbrella cell, so here first cells is urothelial cell we can observe, other one is umbrella cell. These are the normal cells present in urine. So they are larger than the transitional cells and have abundant cytoplasm and 2 to 3 nuclei. So here, this is compared with the urothelial or transitional cells. Here, the umbrella cells are larger, and mm, cytoplasms are abundant. Here you can see 2 to 3 nuclei, but in urothelial cells or transitional cells, you can see the single nucleus. So here, the main feature of the umbrella cells, multinucleated one group of cells, and the pseudo papillary aggregations are more common seen in the catheterized urine. So we already discussed we can um, receive three type of sample: voided urine sample, and catheterization urine sample, and bladder washing. So here, so when you look at the catheterized urine sample, there are some morphological changes you can see due to the catheterization. So here, mm, this cell pseudo papillary aggregation you can see in commonly in catheterized urine sample. Here you can see the, yeah, right, this area pseudo catheterization. These areas you can see here. These are the catheterization areas, right? So when we consider the superficial in urothelial cells or umbrella cells, so here there are different uh, staining method they are used. Phase contrast, under phase contrast microscope you can see multinuclei and bright field without staining. The second picture, second column, you can see the cytoplasm, nuclei and other things. So bright field toluidine blue staining, here you can see multiple nuclei. Inside the nuclei you can see nucleolus and the cytoplasm irregular umbrella shape. So other one, the bright field other extras also you can see. So here next one is the columnar cells. These cells are rare in voided urine but seen in specimen obtained by instrumentation. So here normally we cannot see in columnar cells, but if you obtain by instrumentation, yes, you can see in these cells. So columnar transitional cells are a normal and relatively common finding in specimen obtained by instrument of the bladder. They also can arise from the urethra, particularly of men, as well as in the uh, cystitis cystica. Usually benign, but can also be seen in well differentiated papillary neoplasm also. So the condition where we can see first is if the bladder urinary tract are normal. So during the instrumentation we can see this columnar cell, but other catheterization sample or voided sample we cannot see in these columnar cells. Rather than this, the instrumentation, if the columnar cell is present, so we can conclude this is papillary neoplasm, right? So here you can see that this is column-like cells. We can see the nucleus eccentric one side. So next we will move into the atypical cells. So atypical cells, these can be seen in the neoplasm of the urinary tract. For example, urothelial carcinoma. Right, this is atypical cells. Normally, this is not present in normal healthy urinary tract. So, if any cancer in urethra or urinary tract, we can see in atypical cells. So when we consider the atypical cells, so here NC ratio is high because during the carcinoma what happened, the normally what happened in the cells are growing, undergoing mitosis and it will mature. During the maturation what happened, the cell cytoplasm, the immature cells, when we consider immature cells, the nuclear the size is larger. It when it's matured, the nuclear size is reduced because the chromatins are uh, packed. So, but in immature stages, nuclear chromatins are loosened, so loosely packed. So we can. That's why it's larger. and active. So we can say, but so in atypical cells, there are due to the carcinoma, what happened? It failed to mature. So we can see immature cells. So NC ratio is higher. So you can see here the picture. Mm, there are two cells you can see, larger one. This is normal cell. First, this one. This is normal cells. So this is uh, atypical cells. Normal cell you can see the cytoplasm, the contents evenly distributed, nucleus also the evenly distributed. But atypical cells you can see the sizes, compare these two size. The atypical cells are small size and the NC ratio is very high. Actually, this is the rim-like cytoplasm in atypical cells. Um, and nucleus, when you look at the nucleus, it is occupy most of the cells. And chromatin, you can see coarse chromatin, and this is intact. Nuclear membrane is irregular, but in normal cell you can consider this is very nice spherical like shape, but here the nuclear membrane in atypical cell irregular, nuclear chromatin pattern clumped. You can see here. Here you can see nuclear clumps. Here these dots are nuclear clumps. So limitation, when we consider the limitation of this is poor sensitivity. So when we consider the lower grade urothelial lesions, the sensitivity is lower because cells are very low in number. Normally when we consider the urine sample, we can see in very low numbers. And inadequate or suboptimal specimen we can observe. So during that time, absence or limited number of urothelial cells identified. So these two are the limitation of these specimens and other things. One is the poor sensitivity because of the low grade cases. The cells number already normally when we consider urine sample, the cell number is lower. So in lower grade cases, actually we cannot find the abnormal cells very low concentration. So sometimes the specimen is inadequate, not enough, or the suboptimal. So again the cells absence or very limited number of cells. So here we can see the normal urine cytology, some little changes. First one, you can see the cells, urothelial cells and other things. Here there is a, and when you consider the cytoplasm, the cytoplasm contents are evenly distributed. When you consider the nucleus, there is smaller color and dark color. The NC ratio is lower. So when you move into the second picture, slightly atypical cytoplasm. Here compare the first picture and second picture. Oh, the size of the cells are very smaller. NC ratio is higher. Nucleus is larger. Cytoplasm is the smaller volume. NC ratio is higher. And when you look at the nuclear membrane, uh, it is irregular, right? And intact. One to one, it is intact. When we consider the semi-atypical cases, it is also NC ratio is very higher, and you can see the projection like pseudo projection, papillary projections you can see in here. So we will discuss it into next class as cyst fluid cytology.